Okay, so real quick to start with, I wanted to just apologize for um, the chaotic rollout of this course. Um, I do understand that it has been confusing um, at a lot of different areas. I do apologize, and today my goal was to try to answer questions and clear up confusion. And it did take a different direction, and that's okay. I do want to hear what you have to say, what your feedback is. Um, I really do, and I'm trying to make this smoother from here on out for you guys. Um, I'm working hard to do that, and again, I apologize for any confusion. I know it's a lot, and and it could have been executed better from the start. Now I know. Um, Now we know for the next time that we run this, what works, what doesn't work, and that is good feedback for me to know. So, um, if you have like any like specific complaints about anything like clinical related, um, that's not about the schedule, just come talk to me privately, and we'll try to figure it out and discuss it and see what we can do. Um, but again, sorry for the chaos, but I just wanted to get that said and out of the way. Um, I'm not denying anything, like I'm not blaming any of you guys or saying that you are out of line because that's not the case. I understand where my errors were, and I am trying to work on fixing that. So, um, that being said, it is a course that has two subjects in 8 weeks, and it does make it very fast paced and hard to keep up. And then, of course, we have a holiday right in the middle, or not in the middle, but on one of the important weeks, unfortunately. But we'll make it work. Um, so the other thing I wanted to say real quick before we get into this is that um, after talking to Charisse and Stormy, we looked into it more with the proctoring, the ATI proctoring, because we usually don't have to do that, um, you know, do that like proctor it from home. And the issue is that to proctor it or to do it at home, it would all have to be everyone doing it at the same time. So that is something that we had to look into after our discussion today. And there are several options. I'm going to be flexible with this. So um, I can, I will be there Monday at the school if anyone wants to come Monday and I can proctor you. We can do it Tuesday as well. I'm going to be there Tuesday after Amy's lab, and I'll proctor. Um, since you guys will already be there, I'm assuming the majority of you will want to do it that way. So I'll be there to proctor you for that. And you can also schedule it through the testing center. That being said, the testing center doesn't always have like a lot of availability. So if you run into that and you really need to or want to take it at the testing center, please contact me because I can get in there and try to find you a date that works within that time frame. So um, just let me know if that's what you want to do and you can't find a date. Um, but otherwise, I can definitely proctor you Monday. Um, and Tuesday after Amy's lab. And quite honestly, after clinical on Friday, I could probably proctor anyone who wants to do it Friday. So um, just let me know if that's the case, and that is perfectly fine. Um, we can make that work. So I just wanted to announce that because I know it's just one more thing. Um, and I do apologize for that. but now we know. Um, and also, if it's trying to charge you money for doing the proctoring on ATI, please let me know because it shouldn't do that and I can fix that. Um, so anyway, getting into the study guides. So for every exam, I do make these study guides. And what I do is I go through the exam and I go through every question on the exam and I will make notes over here. So I'll highlight a bullet point, and if there's a question that is correlated to this bullet point, I will come over here and make a note about what it is I want you to know about that bullet point. Um, so I try to be as thorough and detailed as I can on these without giving you answers, of course. So I highly encourage you to look through this and read those comments. It is helpful, and in a lot of them, I will put the slide number of where to find that information. So anyway, that's kind of how I'll always have these set up. So jumping into growth and development, um, starting with infants. So first bullet point, developmental changes in the first year of life. And I want you to know like the weight changes, like how much weight should be gained at specific points of infancy compared to the birth weight. So, for example, by 3 months of age, how much more should they weigh from their birth weight? Should it be like double the birth weight? Um, by 6 months, should it be triple the birth weight? That's kind of what I'm referring to. And you'll find that in that slide in the PowerPoint. Um, Also, common behaviors that you'll see in infants. Hold on, I think I skipped one. Just a sec. No, no, I didn't. So yeah, common behaviors for infants. I put C slide 4. So I'm looking for like normal versus abnormal. And again, a lot of this is educating parents. So if you are the nurse to um, a that it's a 4 or 6 month old baby and they're not doing this or they're doing this, and it's either a red flag, it's abnormal, or they're right on point, how would you educate the parent? Like, what would you say to them? That type of question. Um, again, see slide 4. Motor development. So, um, oh, and also other than behaviors, the physical developmental red flags as well. Um, the growth, the um, coordination, that kind of thing. And then for motor development, what's the expected motor development milestones at each stage of infancy, like 4 months, 6 months, 8 months? For example, should they be rolling over at whatever age range it's giving you in the question? Should they be able to be like babbling 1 or 2 syllabus words, sitting, control of their neck, that type of thing. And you'll find that in the slides in the PowerPoint, of course. But that's kind of what I'm referring to there. And then, of course, lots of parent teaching and education. Um, so what are some recommended toys and play activities that you would educate the parents on for an infant at whatever age they are? Like Johnny jumpers, those walkers, things, those toys that have a lot of sensory stimulation. Um, that's what I'm referring to there. Moving on to toddlers. So, oh, and real quick for infants, I'm so sorry. I don't know why it keeps doing that. I skipped a couple. So I talked about toys, and play. Infant care is a big one. So interaction with the infant, use of pacifiers, um, diaper changes. So how often should you change their diaper? Um, you shouldn't leave them sitting in a car seat or their crib for long periods of time. Um, how should you go about using pacifiers? Um, that's basically what that's referring to. And how, the bonding with the infant, how the parents bond and play and stimulate with the infant. Um, so study those topics. And then car seat safety, of course. So we should all know for infants, especially under a certain weight and a certain age, they need to be rear facing in the car seat. So that's important. And the car seat needs to be up to date. Um, for instance, on postpartum, we always have to check the expiration date, um, especially if it's like their fourth kid and they've had this car seat for a while. It's important to kind of look and see if it's expired. You can't let them take the baby home in that, unfortunately. So that's important. Okay, so now moving on to toddlers. So what are some recommended play activities for toddlers for development? And I put see slide 18. If you look at that slide, that lays out exactly what I'm referring to with that question. Um, expected psychosocial developmental tasks. Um, so, how should they be interacting? How should they be thinking of the world? And I put C slides 5 and 9 for ideas on what that's referring to. Um, and then leading cause of death or accidents and how to prevent. So, like health promotion and hazards. So, toddlers are everywhere, they're into everything. So, just educating parents on how to prevent any accidents or fatalities, of course. So, stairs, pools, outlets, medicines, that kind of thing is what that's referring to. Um, okay, so moving on to preschoolers. For preschoolers, there isn't a whole lot, but basically, uh, growth and development wise, um, there is a question referring to speech issues. So, what would, if you were the nurse taking care of a preschooler, what type of speech pattern or speech um, development would cue you in that maybe this toddler needs speech therapy, like a lisp or a stutter or anything like that? So, when would that be warranted? Um, So moving on to school age children. So psychosocial expectations, health and development. So for school age children, they're becoming more independent. So it is that's part of their growth. Um, they're asking more questions. They're becoming more motivated. A lot of times in school activities as well. So that's kind of what that's referring to as far as psychosocial. Um, and then appropriate or worrisome behaviors. So what would cue a nurse in to maybe there's some red flags, maybe something's going on um, that needs more attention. Maybe the parents are telling you something, or you're noticing it yourself as you're assessing the child. So, school performance is often an indicator, maybe behaviors that they're exhibiting. So, uh, take a look at those slides that talk about that. Preventing lice, that's a big one at this age. So, not sharing hats or brushes or combs and lice checks because we know how how fast that spreads. So, educating parents on that. And then at this age, how to approach and treat a child as a nurse when you're doing like a procedure or anything that might be considered a little bit invasive. whether it's an IV or a catheter. And I put C-slide 21. What would help them feel more comfortable and safe? And it kind of goes back to they're basically psychosocially gaining some more independence. They're wanting to know more things. So discussing what you're doing and making sure that they feel like they're involved is very important for the nurse. And then adolescence. So what developmental task would be expected at this stage? And I put see slide 8 in the adolescent PowerPoint. So, adolescents, they're finding themselves, they're trying to, um, um, they're basically finding their identity. So, finding their place in the world. So that's kind of the area that I'm trying to hint at there. And if you see slide 8, you'll know what I'm referring to. Um, Major developmental tasks. So, where would you expect a teen to be developmentally? And of course, it depends on if we're talking about early teen versus late teen. Um, but like, what are they achieving or mastering? Um, what are they getting better at? And of course, a lot of this refers to some of these developmental theories. Um, but what is it that that you start to notice? And I know that's pretty vague. Um, and that's kind of as close as I can get without giving it away. But um, just look at what they should be developmentally achieving at this stage. Common screenings for teens, and then I put as a hint, often done at schools. Um, we've all had this. Usually, it happens in like middle school. Um, uh, they're going to check for scoliosis is as a common one. And then suicide risk factors, it's a big one. There's a lot of hormones and emotions going on in the adolescent years. So suicide risk factors and screenings are important, especially if the parent is suspicious or if you, as the nurse, notice certain cues that the adolescent's giving off. And I talked about in one of the recordings, or in the adolescent recording, that um, we know that young boys, teen boys, and men, um, that's on the rise. And so it's important to assess for that. Um, are there things that they're doing that they didn't used to do? Are they acting different? Are they saying things? Just assessing that. It's important to get a handle on that sooner than later. And then peer interactions and relationships. So normal versus abnormal. Um, they should be um, developing close friendships with the same sex, and it's normal for them to develop relationships with the opposite sex. Um, but there is a lot of peer pressure. There is a lot of pressure that goes on in the teenage years that can have an effect on a lot of teens mentally and socially. So, what would be normal? Um, it- and if you were caring for a teenager, if they said something, if they said a sentence, would you be worried or not? Would it be something that you want to look into? So that's kind of an example of the type of question I'm getting at there. Um, okay, so and of course, real quick, nursing skills, nursing measures. There's not a whole lot on the test about that, to be quite honest, but they are things, of course, that you should know. Um, but most of this you have done in your earlier courses before this, so I'm not too worried about that. Of course, with all infants, we do an axillary temp, so that's an important thing to note. Swaddling and safe sleep. Um, so. the Back to Sleep campaign. We know all infants should be placed on their back to sleep. Nothing in the crib, no loose blankets, swaddling. That's safe sleep methods um, to prevent SIDS or SUIDs. So moving on to nutrition. So some teaching topics. Again, lots of education when we're talking about this area, this exam. So nutrition in infancy. So this was mentioned in the lecture recording. What are some teaching points about that? If you recall, when to introduce new foods, how to do it, do it gradually, avoid introducing foods that are common allergy, um, that cause allergies, like, peanuts, peanut butter, that kind of thing. So that's what I'm referring to there. Poison control. So just educating parents on actions they can take if or when their child ingests any toxins or poison or too much medication. Um, what education would you give them? What would you tell them? Of course, usually Poison Control Center is a big one. And then abuse. So, what is the nurse's responsibility if they suspect a child is being abused? So, if you're seeing bruises, um, a skittish behavior, if they have frequent um, broken, or fractured bones, um, if there's signs or worries of abuse, it is always the nurse's responsibility to report it. You always have to report it. The nurses are mandatory reporters. So that's important to know. As far as developmental theories, Erickson's stages of development is the main one for the test that I want you to know. So, in this specific question, I want you to order the stages of his theory from first to last. So, focus on Erickson's. And then immunizations, just basic concepts. So, a vaccination safety. So, if a child or baby is allergic to like eggs or egg products, you're going to want to avoid the flu vaccine. If they have an illness, maybe delay the vaccine. And if they have like an immune condition or immunodeficiency, most vaccines you're not going to want to give until that's under control, um, or there might be some other alternative, but just basic safety um, concepts for vaccinations. Um, Nothing too in the weeds, I promise. Um, so that's really it. That's what I want, the main points that you need to study for this exam. Again, I went through every question and I put it all on here and what it covers. The only other thing is the five math questions. So I did post in the math worksheet and the math key, and I tried to put step by step um, what. Let me switch to share that screen with you. How to solve that. And I'm going to be pretty lenient on some of the math questions just because of how things have rolled out these first 2 weeks. We haven't had a lot of in-class review. Haven't gotten to do this in person with you. So I am going to be more lenient. I know you guys have learned conversion factors. So my focus really on this first exam is going to be on that. So, converting weights and determining how much medicine to give based on the weight of a child or infant. Um, so real quick, number one, a newborn was born weighing 4265 grams. And just a side note, we always weigh and chart newborns in grams, not pounds, just FYI. So 4265 grams. On day 2 of life, the baby weighs 4125 grams. This is very normal for infants to lose in the first few days, um, maybe, first week for them to lose some of their birth weight. That is normal, very common. We just don't want that weight to exceed 10%. So we don't want them to lose 10% of their birth weight. So that's what we're looking for. Um, so how many kilograms did the baby weigh at birth? Okay, so we know the baby weighed 4,265 grams. And conversion factor, we know 1 kilogram is 1,000 grams. So we're going to take 4,265 divided by 100, and that gives us 4.265 kilograms. Um, so that's that part. And the next part, how many pounds does the baby weigh on day 2 of life? So now we're going to pounds. Um, there is this method. I prefer, and I think it's easier to do this one right here. I have or, and I put this second part. So it makes more sense to me, straightforward. Take grams, convert it to kilograms, just like we did above. So 4125 grams, 2 days of life. We're going to convert that, divide that by 1,000. So we're going to get 4.125 kilograms. And then if we use our conversion factors, we know 1 kilogram equals 2.2 pounds. So we're going to take the 4.125 kilograms times 2.2, and that gives us our pounds. So 9.07 pounds. And then the next part is what percent of weight loss did the baby experience? Round to the nearest tenth. So, like I said before, we do look at this. I will be honest, the chart calculates that for us nowadays, but it's still good to know. Um, so this right here in bold is the formula to figure out percent weight loss. So it's the initial weight, which we know is 4,265, minus the current weight, 4125, over the initial weight again, 4,265, times 100. So you do that formula, that gives you 3.3%. And again, it said round to the nearest tenth. So we got 3.28, but we rounded to the nearest tenth, so it's 3.3. Again, when it says round to the nearest tenth or hundredth, um, I'm going to be more lenient on that, just again because of how things have gone these first couple weeks. So um, try to, if you can, round, but if not, I'm not going to be that strict or concerned about it this first exam. So I want to do the first 5. These are the main ones that are going to be on the exam. Um, I don't want to get too complicated on the math because of what I was just saying. All right, so number 2, a child weighs 35 pounds. He is to receive a medication with a recommended dosage of 50 milligrams per kilograms a day. So with pediatrics, you're going to see most medications are going to be per kilogram. So how much medication will this child receive per day? So first, what we're going to do, we have 35 pounds. We want to convert it to kilograms. So again, 1 pound um, equals 0.453, that long number of kilograms. So that gives us 15.87572 kilograms. Now, up here it says do not round your kilograms in that first step. I advise this because it will mess up your final result. So do this first step, but keep that whole number, don't round it, and plug that into your next step. And that's so that you get a more accurate answer. So that's why I put that on there. So, okay, we got our kilograms. So now we're going to calculate the daily dose, which it tells us is 50 milligrams per kilogram. So we take our kilograms we got in step 1 and we multiply it by the 50 milligrams. And that gives us 793, 0.786 milligrams a day, round to the nearest hundredth, and then, 793.79. So convert to kilograms, use those kilograms to calculate the dosage based on what they gave you in the question, and then you got your answer. Number three, excuse me, an IV infusion of 540 mLs is started at 7:20 p.m. It's ordered to be given at a rate of 30 mLs an hour. Calculate the infusion time, and it wants it in hours and minutes. So again, in bold, I have this. Infusion time is the total volume divided by the infusion rate. And thankfully, it gives us both of these in the question. Our volume is 540 mLs. Our infusion rate is 30 mLs an hour. So we just identified our values, and now you're going to calculate doing this. So 540 mLs divided by 30 mLs an hour will give you 18 hours. And it's a round even number, so we don't need a round. So 18 hours. And then the next part of the question is what will be the completion time? So what's 18 hours from 7:20 p.m.? And it wants it in military time. So 13:20, which is 1:20 p.m. A nurse is preparing an oral dose of amoxicillin for a 3-year-old with acute otitis media, which is an ear infection. The child weighs 33 pounds. The dosage prescribed is 50 milligrams per kilogram a day in 3 divided doses. And then it gives you the concentration, which is 250 over 5 ml. So the first part is how many mLs should the nurse administer per dose? And remember, there's 3 divided doses. So let's break this up. Step 1. Again, we're going to want to convert the pounds to kilograms because we want to know that, we're giving 50 milligrams per kilogram. So let's convert 33 pounds to kilograms, which gives us this number right here. And then now we want to calculate the total daily dosage. So that's just per day. So the prescribed dosage is 50 milligrams per kilogram per day. So we take our kilograms from the first step, times it by 50 milligrams, and we get this number. Now we want to know what is it per dose. So remember, there's 3 doses of this. So all you're going to do is take this and divide it by 3, and there you go. That's your dosage per dose. And then the last step to get to how many mLs, convert these milligrams to mLs using the drug concentration up here. So the drug is 250 milligrams per 5 ml. So we use our dosage per dose, and we divide it by 250 milligrams times 5 ml, and that gives us this, and we round it to 5. I know it looks like it's a lot when you're reading it, but if you break it down step by step, it is much easier. And like I said, not going to be super strict on this. I understand that we haven't had time to go in depth in this. So again, I'm going to be lenient on that. And another thing is in every class I teach after the exam, once everyone's taken the exam, I like to go through and look at the average. And I try to look at questions that the percentage of people who got questions right. And if a large percentage of students got it wrong, I look deeper into that question and decide if I should throw it out or not. So I try to be fair. I am going to, if you all come to me and say, this question did not make sense, or I did not understand this, or I could not find this in your lectures, tell me. I'm reasonable. I will look into it, and I might throw it out. So That is always a strong possibility. So after everyone's taken an exam, I'll go through it, we'll talk about it, and then, go from there. And then this last one, I know there's more on here, but these are the ones that I want to focus on for the exam. So the drug label states the appropriate dosage for ampicillin is 20 to 45 mics per kilogram per day. The child weighs 105 pounds. So again, what's the first step? We're going to convert the 105 pounds to kilograms, which gives us this number. Um, and now we want to, because it's asking what is the dose range. So we're going to use the range given up here and multiply our kilogram, our weight in kilograms, by the lower dosage and the higher dosage range. And that's going to give us our answer. Um, so the range is 952.54 micrograms a day to 2143.22 micrograms a day. And then it asks, the doctor orders a dose of 2,500 mics to be given once a day. Is this range appropriate for the child? And obviously, no, it's too high. Um, so um, we've calculated that this is the appropriate range for the child's weight. So the doctor's order of this is too high. And then if that's the case, we need to say, hey, I think, you know, and it is hard to tell doctors this, but you might want to review that because this is the child's weight. And then, we can fix that. So that way the child doesn't get too much medication. Um, I hope that made sense. I know it was a lot. Um, please ask me questions if you have any about any of this math, and we can meet either in the office or we can do a one-on-one Zoom. We can do whatever works for your schedule to figure this out together and do some more practice problems. I want you all to succeed. I really do, and I want to help you get there. So please don't hesitate. Let me know. I'll do what I can to make this make sense if you're struggling here. Um, which I understand math isn't my strongest area either. So there's no shame in that. Um, okay. So that's basically what you should focus on for the exam. And again, I will let me know if for the exam, neither Monday or Tuesday works for you, and we can figure something out. But that's it.